We need to stop saying we treat you like family.
Oh, please, please. We need to put the kibosh on that.
It's way overused. It doesn't resonate with people. Like every dentist says it, along with generic stock photos.
Yeah.
So
It has no impact anymore. It means nothing anymore.
yeah. So okay. So what should we be saying instead? Right.
Right. That's the big question.
That's what we're going to be talking about today.
Yeah.
Is what should you be saying instead, so you can attract the right patients and to your practice, and what you still feel good about yourself.
Right.
Inside.
Something that actually aligns with what
Yeah.
you really do in attracting the right
Yeah,
patients.
and that's called brand messaging is the topic,
Yeah.
basically. So first off, we should probably say who we are, why we're qualified
Yeah.
to be talking about this. I'll let you start.
So my name is Dominique. I'm the CMO at Marketly. And me and Mel together, we've put almost probably a quarter of a century together between the both of us and focused on brand messaging, from working through hundreds of websites for different dental practices across the entire United States, as well as running ads for these dentists where you can really see day by day what messaging is working and resonating and what isn't.
Yeah, we've together tested thousands of hooks
Yeah.
and scripts and lots of knee to knees to figure out what is actually resonating with patients and everything. So I'm really excited. This is probably one of my favorite topics to talk about.
Yeah, definitely.
Yeah. So let's get into what exactly is brand messaging? What does that even mean?
Yeah, so brand messaging is really your alignment with how you're attracting patients. It's talking about your story. It's talking about why you got into what you do and how you help those patients, and being able to really speak to their pain points, their desires in a way that attracts them. How about you? What would you say is brand messaging?
It's just how you communicate yourself to the public and how you are going to solve their problems. And it's narrowing down exactly how you speak to the patient you want to serve. Not everybody, but that ideal person that you would love to clone over and over again.
Yeah, and you said something really important, speaking to that patient. A lot of doctors get stuck in doctor speak.
Yes.
And their language would actually be attractive to another doctor, right? But patients, they don't understand or care about occlusions or, really detailed technical stuff. So it is about getting a little bit outside of your own head and what's important to you and putting your attention on your patient and really what do they want to hear.
Yeah, I always, that's the first thing you should always do when coming together with your brand messaging is who is that person? And usually it start with just imagine that one person, like one patient. You're just like, I want more of these guys or gals.
Right.
And then really digging into what were their pain points, what are their desires, what are their fears, and that's beyond dentistry.
No, it is. It's about honing in on that one patient. And even if you look in the past 2 or 3 months, what patients came in that you really fell in love with? You connected with them. They valued what you had to offer. They were financially qualified, and asking yourself, why did they come in? What attracted them to us? And maybe even in the future, like asking them, like, so why were you attracted to us? Was it, a video on your website? Was it, anything that you're talking about in terms of qualifications? Or is it how friendly your office was? And that won't be the entire picture, but it will give you a starting point in terms of how can I attract more of those type of patients.
Yeah, absolutely. Absolutely right.
What other gaps would you say that you see with doctors when it comes to their brand messaging?
Well, you said it before, they get into doctor speak. They focus too much of like what they do and not how they can help. They need to focus more on patients don't come in for cleanings to get their teeth clean. They come in because they want to be healthy and feel confident. And so that's the language you need to speak to them.
Right.
And saying that you have great customer service is not great. Yeah.
Yeah, one thing to speak to that, it drives me crazy when they'll say, hey, we treat you like family, or we have great customer service, or whatever it is, and they don't qualify that statement. Like, you have to not just say, we give the highest quality care. Like, that's the worst thing to say. How do you do that? How do you really dig in and give detailed examples so that people can visualize it and believe it and understand it and really qualify those statements? Like, having all these different layers of sedation for each different type. And, what do you always say about stories?
That they're very, very effective. Someone who listens to a story is 22 times more likely to retain that fact versus a fact itself. So if you're telling someone, well, getting your teeth clean will keep your teeth clean.
Right.
But if you tell the story of Sally Sue who got her teeth clean and then she was out of pain, I know that's very extreme, but that you're going to remember that more than flat out the doctor saying it.
That's a crazy stat, 22 times more, right? And the two examples you gave is the same thing. Get your teeth clean and you're out of pain, but tying a person to it and a little bit of a story, like a little triumph. Why is that? It's so effective.
Why are stories so effective? Because the human brain is attracted to stories. There was a study done where when someone heard a story, the brain, dopamine was released in the brain. It gives you those fuzzy, warm feelings of like love and everything. And so people are just more attracted to that. And it's like, and if they see themselves in that person, it's like, she can do it, I can do it too. So that maybe this guy is the guy I need to talk to on there.
Does the story, does it always have to be like the doctor's story?
No, it could be a patient story. It definitely should be from patient stories because it goes into a marketing psychology of social proof.
Yeah.
Because people are more like, they see the more people that say this doctor's the best, the more they're going to follow the crowd because people are more tended to follow the crowd.
Right.
And so if they see more of that, these patients telling their stories of how Dr. So-and-so helped them achieve the desired outcome, being healthy, having a beautiful smile, they're going to choose them. So that's kind of where you can start with your brand messaging, is finding those patients that you've helped and love to help and ask what their stories are, how you overcame their problems, why they decided to move forward, what stopped them from moving forward at first, and then using those segments into your messaging, because that's what's going to speak to people is when you pull those lines out.
Right. So incorporating patient stories, what would you say are some of the big chunks of different types of brand messaging doctors typically fall into? Kind of the different angles that they will focus on.
There is fear-free dentistry. That could be one segment. Some patients have the fear of they're going to be judged because they haven't seen a dentist in years. It's like, no, we're a non-judgmental office. It's like, what matters is that you're starting today and we're just here to get you happy and healthy. There's also the aesthetic side where they want to feel good about themselves, feel like a celebrity, a star. So that messaging can cater to that. Get your Hollywood smile, feel confident, feel like yourself again. That can be that type of segment. Are there any other segments that you can think of as well?
There's quite a few, right? It can, confidence is one, focused on confidence. And one starting point that we always find, right, when we're doing this together is really helping them to hone in on their avatar, right? Is it the older patient, the boomer patient who, has a lot of money to spend? They haven't been taking care of themselves all this time because they've been taking care of everyone else in their life. But now it's like, hey, it's time to focus on you and, kind of self-care, self-love. Is it like the young professional that's trying to come up in their industry, right? Is it the mom who's thinking about their 3 kids and their husband? What's the best dental care for my family, right? So it's really understanding, like, in their specific area, with their specific segment, what services they have, what is going to be the most effective. And I know one thing that me and you have done, to test this, it's because you always want to go based off of data, right? Everyone can have good ideas, but marketing is all about getting data. Is running different split tests. A simple split test with even $100 behind it on Facebook can give you so much data, like real information in terms of what are people clicking on. And you simply set it up by having those, maybe 4 or 5 that me and Mel mentioned, right? Confidence, fixing missing teeth, care for your family, anxiety, judgment-free, right? And so you have a headline for each of those, and you run them with the same budget, maybe $20 behind, and you see which one got the most clicks. Simple tests like that can give you so much actionable data on top of what we talked about, simply asking your patients, what attracted to us.
Yeah. The biggest thing that you can get started with is just talking to the patients, your favorite patients, and asking them, what was your problem? Why did you not do anything about it? What made you finally do something about it? What's life like for you now since you've gotten this done?
Yep.
Those will help you define not your brand messaging and like what makes you unique that you can really lean into, you feel comfortable with, and just blasting that everywhere, basically.
And you touched on it a little bit earlier. Why is it important to bring in the emotional side or the emotional benefits versus just the products and services?
Because people buy from an emotion, not from logic. They see something they like, so like, oh, I need that, and they buy it.
Right.
It's like, I probably should not be getting this thing on Amazon that tells me I need it, but I feel like I need it. That's why. The more you lean into the emotion, speaking to them from that emotion that makes them think that you're in their head, the more that they're gonna like, yeah, I gotta choose this guy. He gets me, and I don't even know this guy yet.
Right. And one of the oldest marketing principles, right, is speak to people, like match where they're at currently in their head and then bring them to where you want to be. So if you're speaking to people only from your perspective, it might not resonate. If you can have a message that aligns with the problems, the concerns, the hopes, the fears, the desires of where they're at on a day-to-day basis, right? Because everyone has a narrative in their head 24/7. So if you can match where that's at and then bring them into the solution, which is your dental practice for this specific case, the more effective that brand messaging is gonna. Let's narrow it down. Like, what would you say is one question that every dentist could ask themselves as like a starting point to craft their unique brand message?
I would say there's two. The first one would be, why did you become a dentist? And the other one would be, what are your core values? What adjectives really excite you that you're doing what you're doing, whether it's you love to help people, health, wellness, and how authentic and edgy are you willing to be to sound different? Because everyone else is saying we treat you like family. So how can you say that if you lean into those two questions and really think about it while thinking of your avatar's desires and their pain points, what they're saying, then that is what will help you resonate, create that messaging, and rise above that noise of we treat you like family.
What would you say to a doctor? Let's say I was a doctor and I said, well, I want to treat all patients. I want to attract all different kind of patients and, kind of hit it from all different type of angles.
Well, you do know those people that are on the street shouting at everybody. Do you pay attention to him?
Of course not.
Yeah, that's what's happening when you say you want to treat everybody. They're just ignoring you. And it doesn't mean that you need to like ignore everyone else. Those people will come, but if you really dial in that avatar and speak to them with your messaging, they will come, and then people will come with them because then they'll bring in their families. Other people that are on the wayside aren't your avatar will like what you're saying because it's so dialed in.
No, that's true.
Yeah.
What other steps do you think would someone need to take to align their message to their ideal?
They need to, like I mentioned before, they need to talk to their patients.
Yep.
And then they need to test that messaging out there and see what is resonating, what's not. You can save it to your favorite patients. Like, how does that make you feel when I say this? And get feedback from that, and you need to adjust from that. Because you're always testing your messaging, even though you're like, I love this. You got to make sure people resonate with it. And then you go from there and adjust it till it feels absolutely right.
Do you think it's worth kind of running it with your team, seeing how your team thinks?
Yeah. Oh, yeah, absolutely. Bring your team in. Absolutely. Bring your team in, see what they think. You can even get fun with it if you're on social media and see what other people are thinking. Alex Hermosi does this all the time. When he's talking about new products and stuff, he says, what do you prefer, this or that? And that's how he gets his data and see what's resonating with people.
Yeah, and I would just say to anyone who's a little bit apprehensive about it, our messaging, our mission is that we're industry disruptors and we champion heart-centered dental groups so that they can get tangible ROI daily so that they can focus on their community smiles. And in the very beginning, when we kind of crafted that, it seemed a little bit like fluff, but the more that we instilled it, the more that we worked it with our team and really started to live it, the more power it had. And it's really allowed us to attract a different caliber of clients. So it does really have an impact on what you're doing. Your brand messaging, a lot starts there.
Yeah, absolutely. And I mentioned core values, and that really honed in our core values.
Yeah.
And we live off it, and it is reflected in our messaging. Client results driven, high energy.
It becomes a war cry.
Yeah.
It becomes a culture.
Exactly. And when it becomes your war cry, other people will follow that war cry.
Yeah.
We talked about have a starting point to get started with your messaging. Are there any other quick wins you can think of that someone can just try right away?
I would say auditing your website. Your website, it's more than just a digital brochure, but it can be the foundation of your brand messaging, right?
Yeah.
And making sure it also is authentic and reflects your personality. You have to really balance your personality with what you do and, how you're trying to serve with the, personality, desires, and outcomes of your target audience. So if you can find that balance of all three, then you found your perfect brand messaging. Are you a little bit sassy on your website, right? Are you a little bit fun? Are you trying to portray an extremely professional environment or really push, high technology? And again, like you mentioned, you can't do everything, right? You could sprinkle everything in there, right? Hey, we take care of our patients. We have sedation options. We have blankets. But your brand messaging should be really narrowly focused on one while kind of sprinkling in, everything else for sure.
I would add to the website audit is when you look at the copy of your website, looking at the voice, is it saying we or is it saying you? You want it to say you, like you're talking directly to that one person. That's like a little magic pill that'll really liven up the messaging on there. Because I don't care what, like we just means you're talking about yourself and no one cares. They care about themselves. And how are you going to help them?
That's absolutely true.
Yeah.
Nice. I mean, bottom line, your brand messaging, it's not just about something that sounds good or sounds pretty, right? It's about finding, your authentic message that is going to represent you, your practice, but at the same time attract the kind of patients, the high value patients that really value what you offer, right?
Yep, absolutely.
Yeah.
I think we got a lot of good stuff for our doctors today.
Yeah. Awesome. And if you found this episode helpful, don't keep it to yourself. Make sure to share it with any colleagues, any other dental offices that that need a little help with their messaging. You know who you are.
Yeah, and don't forget to subscribe to our channel if you want more marketing tips and tricks like these every week. Thanks so much.
Thanks, guys.